everyone, welcome back to the Monthly Affair. If you haven't seen our previous episode where Dr. Ho tells us more about the menstrual cycle, period complications, and how to take care of your body, go check it out right now. For this episode, Dr. Ho will be answering your questions based on our Instagram page. So firstly, one of our followers asked, is it normal for the number of days of my period to decrease? A few years ago when it just started, it was 7 days, and now it's 4 days.
Yes, it is quite common to have the menstrual cycle length getting lesser as we age. This is due to the the follicle numbers that reduces along as we age.
Why is there a delay to our period?
Are we referring to amenorrhea? If you're referring to that, the most common reason is pregnancy in those who are sexually active. In those who are not sexually active, there are various causes. For example, in girls who are very active in curricular activities, that could be due to the hormonal imbalances, what we call hypothalamic amenorrhea, or many other causes involving the hypothalamic pituitary or even the ovarian axis in those who have attained menarche. So this will require, again, a thorough clinical examination. The investigations and also imaging to further assess.
So another follower asked, is it normal for us to have 2 periods a month?
So again, it depends on the age of the girls who had this period, or we call it polymenorrhea. If it's persistently across many cycles, consecutive cycles, then you should seek medical advice.
Is it normal for a girl our age, 18, to skip their period for 3 months?
So once again, we goes back to whether this lady is sexually active. If it's 3 months without being sexually active, I would advise to do a urine pregnancy test throughout pregnancy as the most common causes. As we mentioned earlier, in a secondary amenorrhea, it's 3 months. So it again depends on this cycle length of the girl, whether it's regular or irregular. Sometimes in women who has irregular period, they can have once a period every 3 months. So again, go back to the basics. The history will need to be attained before we can further advise whether normal or not.
Is it true that we shouldn't drink ice water?
It is a common myth, but however, scientifically it's not proven.
Is it normal for a woman to lose their appetite during their period?
Well, those who have premenstrual symptoms, they may have a bit of mood changes. So this may be one of the symptoms that may experience. I couldn't really say whether normal or not, but we do have women who experience more lethargic during the menstrual cycle, so that causes them to have less energy, less appetite during the period time.
If we have non-stop brown discharge for more than a year, does it indicate any underlying disease?
So if one experienced continuous brown discharge for more than a year, I would strongly encourage to seek medical treatment or even further medical advice for further investigation. Yeah.
Is it normal for a girl to have spotting before period?
Some girls may have spotting immediate before the period, which can be normal. So that will require a thorough menstrual diary and clinical history with examination to attain whether this is normal or not.
What is a sign that we should start to seek medical care?
We talked about a normal menstrual cycle earlier. Anything that differs actually, you should come in to seek some medical advice and evaluation. Yeah. So anything that differs from the normal cycle length, the duration, the amount, the pain which starts to affect your lifestyle, for example, absence from study, absence from work, from school, your normal quality of life, or any in-between menses unexpected bleeding, what we call intermenstrual bleeding, or even bleeding after sexual intercourse, also called postcoital bleeding. All this, if you experience any of this, you should. I would advise you to come in to seek medical advice and rule out other underlying causes.
Another question: Is it okay for us to exercise during our period, and what is the limit?
it is definitely advisable to keep your normal lifestyle during the period. One lifestyle should not be affected by the period at all. If your quality of life or your normal lifestyle are affected, so you might be experiencing some of the abnormal menses or abnormal symptoms that we mentioned. There is no current limit to the exercise that you could do. You could carry on with your normal exercises. Some of the swimmers, they can carry on with their swim with menstrual cup or even tampons, for example. So you should not let period deters your normal healthy lifestyle. Just keep active, and period shouldn't be the one that affect your lifestyle.
That is the end of this interview with Dr. Ho. Thank you so much for sharing this information with us.
Thank you, everyone.
For those of you watching, we hope you found this interview helpful, and let us know if you would like to see more of such videos from us or anything else that you think we can play a part in. Lastly, follow us at The Monthly Affair, and we will see you soon. Bye bye!